Oh, okay. Like behind Frank's.
Oh,
yeah,
to the
there's-
south, to the southeast.
Over by the legals over there. I don't know, but he's.
Okay.
And he said a lot of people lost their licenses. So.
Oh, is that right?
Because you remember they would used to park on the road and all that stuff during hunting. And he goes, they can have licenses for orange and got a legal deer.
Kind of like.
That's something.
Yeah.
Back in that area.
Yeah.
Hey, Caleb, how you doing?
Pretty
good. Debbie, I got some stuff for you.
Okay. Does anybody have a Mylar?
Kelly.
Okay, I haven't, she's coming up.
Yeah, a little bit, you know.
Just at the house.
Okay.
Just at the house.
A Mylar and the appropriate.
Not a lot of deer in our neighborhood right now. I don't know. You know,
Oh, very good,
I
Caleb.
haven't seen a ton.
copies.
Yep, because
Sign.
I printed out
Dad did one
copies
last week
Oh,
or
yeah.
first weekend.
floating around, so,
Sorry.
nope, that's okay.
He's good for that. He hasn't shot a deer in 10 or 12 years. And like the 4 or 5 before that, I don't know, we didn't find a couple of them, a couple other ones.
Yeah, see, they have problems.
I don't know why you can't shoot a deer.
I screwed up on one
And building.
day. I don't know
That way.
if I got it anyway, but it won't forward. Just looking at something, I can see.
So he doesn't consider,
Thought I saw
see the facilities on here.
all of a sudden right down below me, I see some. By the time I take the binoculars down, a little work.
Oh, yeah.
You know how they kind of go on that fast trot, you know, and he was
Committee report.
this is out of my viewing area.
You don't have to.
Heck, I told Becky 20 years ago that some bitch had been dead many times.
The county commissioners are the.
That's all right.
Okay.
I probably would have passed on them. Time of season, maybe not.
Or people from other counties or others. Josh and JJ, so on the facility committee report, Don Zeman, Mel are both here. Talk about their project.
Okay.
Thank you.
Right now we have. We only have one. Okay.
Yeah. Crazy.
Yeah.
So basically this, I don't know. Oh, I got 2 of these.
You're more crazy now that you're, that's crazy now that you're. You still have stuff to get done.
Oh, no, the house is done for the most part. We'll see. I'm tired.
You're studying all kinds of other stuff.
I get it.
Politics. Trying to get more ambulance coverage.
I thought this one was always in the commissioner updates, but no, this one's over here.
Yeah, we always cover facilities
Brothers are the
quickly.
main-
Yeah, you don't have to do the whole thing, just hit the high place. We're done with that.
With that?
Whatever.
I just couldn't find it on this one, because here I got the soil and water here.
And so how that works,
On there.
JJ,
No.
is if it's on the regular agenda, if it's a county established committee, so if it's economic development or facilities or personnel, those are on the agenda. Outside meetings that you attend, those are what's under the commissioner updates.
Gotcha.
Okay, you can let us go through that. Yeah, I'm not gonna give you.
No, he.
How come Hinckley's here?
He literally is.
She's here.
I read the whole thing this time.
Oh, okay. I just,
It's gonna get to the point where I have no. And it's, I don't know what to do. Yeah.
Morning, Reese.
Morning. Kind of whatever. I don't know what you- They're trying to get them help, but
morning, Kelly.
something wrong. So I don't know. That's what I've been, like every other day is something.
new with that. So were you here when I was talking about this township ad?
It's,
Okay. It is 10 o'clock and we welcome everybody here. I know we have some people that have joined us remotely, have dialed in. So we will call the meeting to order and we'll rise for the pledge. I pledge allegiance to the flag of the United States of America
And to the republic for which it stands,
one nation,
under God,
indivisible,
with liberty and justice for all.
Okay, we have a public forum. If anybody wishes to speak, we allow to speak at public forum. See nobody waving their hands and jumping up. Take that as a no. We'll move on to the agenda, approval of the agenda. We do have some additions. David, you want to go through those?
Thank you, Mr. Chair, members of the board. If we could add consent agenda item number 8, new hires, administrative assistant in the jail, and a part-time correction officer, and also a case aide for health and human services. And then for an additional item on regular item number 6, the old Changotana plat is a maintenance agreement. There's no obligation for the county in this agreement, but the county is a party to the agreement. And in what was in your supplemental information on number 10, we're going to add the county as a party to be included in notices. And then on revisions, there's resolution 21-72 extending a special assessment for a number of property owners. And we have added Larry Setterstrom and Judy Setterstrom. And then just a notice of cancellation of a couple of meetings.
Anything else? Anybody?
Mr. Chair, I'll move as amended.
I'll second.
Ludwig, seconded by Moore. Any discussion? If not, all in favor, say aye.
Aye.
Opposed? Okay, we'll look for the approval of the minutes of November 2nd, county board meeting and summary for publication.
I'll make a motion to accept this.
I'll second.
A motion by Lovegren, seconded by Moore to approve the minutes of November 2nd. Any discussion? Not all in favor, say aye.
Aye.
Opposed? And the minutes of the board's reports and correspondence. We've got Pine County Zoning Board meeting for September 23rd, 2021.
So moved.
I'll second that.
I've got a motion by Ludwig, second by Lovegren. Is that correct?
Yes.
Is there any discussion? Not all in favor, say aye.
Aye.
Opposed? Sign. Move on to the consent agenda with the additions. Item 8, new hires. You've had that in front of you for a while.
I'll move the consent agenda.
I'll second it.
Got a motion by Moore, second by Lovegren to approve the consent agenda as amended. Any discussion?
Question.
Yes.
When I was going through there, I just saw a big number and like a Alina Veldhuis and Tashisha Veldhuis checks for like 176,000. I just want, what is that?
So, Mr. Chair, members of the board, that is a certificate of redemption. So she had put into to purchase a property on a sheriff's auction. However, then the previous owner redeemed it. So then we had to refund her that money.
Oh, okay. Thank you.
Any other questions? If not, all in favor, say aye.
Aye.
Opposed, same sign. Move on to the regular agenda. Facilities Committee report.
Yeah, I can touch on that. when did we meet? We met on the 3rd. Model transition update, we touched on that. The furniture installation was scheduled for the 9th. The North Pine campus here, the roof is complete except for the flashing. The parking lots paved, striping be done next spring. The window tinting was installed in the clear story. Talked about snow plowing, extended for an additional year with Premier Outdoor with no cost increase. The duress buttons were discussed and how to go with a private monitoring service with that. Because of the new layout, the number of duress buttons can likely be reduced. Touched on some door readers, a little bigger TV for the conference room. And it's a quick meeting. We were done relatively early. That's about it.
Yeah.
Good, Matt?
We had a tour of the where they are now. It was back to where it was
Right.
in 2007, and it looked good. Seems like it's working good, and I think they're happy.
Yeah, and then with that, we're gonna try to look at some of the highway shops in the spring.
Yeah.
When we go look at some other buildings.
Good.
Yeah.
The snow plowing contract, I get asked about that every once in a while. Does that come up for, so it goes out for review to all the contractors in the county soon?
Usually do that, and that was a question we asked, and I think Dave can address it for this contract. It was just it's a 1 year, I think.
Yeah, so the current vendor agreed to extend it for a year at no cost increase. And so we thought that was a good deal. And so our plan is that we would do 1 more year with Premier Outdoor and then bid it out for the following season.
Okay. Any other questions? If not, let's see, we'll move on to Personnel Committee.
I'll take that, Mr. Chair.
Yep.
So we met on November 8th, and Health and Human Services Department, we approved the recruitment and hire of an eligibility worker, which is included in the 2022 budget. 6 at 20.49 per hour. We also approved the recruitment and hire of a social case manager position, which is included in the 2022 Health and Human Services budget, and backfill any subsequent vacancies due to lateral transfer for both of those positions, if that happens. And both of those positions are contingent on the approval of our budget and thing in December, the final approval. So they will not be hired until January of 2022, or as soon as they can get them on board after that. In the sheriff's office, we approved the regrade of current sheriff's office manager position from grade 8 to a grade 9, based on the review of our new job description program. And the new title will be sheriff's office supervisor. In the highway department, we approved the backfill of the open highway engineer technician 3 position and any subsequent vacancies that may occur due to internal promotion or lateral transfer. That position is a grade 9 and is a starting salary of $23.94, and that one's in the budget. So, and I will move those items.
I'll second it.
Thank you. We got a motion by Ludwig, second by Lundgren to move the recommendations of the Personnel Committee. Any discussion? If not, all in favor say aye.
Aye.
Opposed? It was kind of a weak aye. Economic Development Committee meeting. Gonna take the,
Where's the notes on those?
Um,
You filled in those, right?
Yep. I can.
Thank you.
I just have to find it. So We met on November 8th, and I sat in for Josh at that meeting. A big part of our meeting, excuse me, we talked about the city of Hinckley. Is this a good time to have them come up, and do you guys want to come up and tell us what your plans are? And we've got the mayor, Donnie Zeman, here, and we've got Kyle, the city administrator, and they can explain to the board what their plans are.
Good morning.
Hey,
Kyle Marks, the administrator in Hinckley. Is the information that we submitted to the board in the packet, or have they not seen the drawings?
It was not in the packet.
I apologize for not providing drawings, so you guys can see the plan that we put together, but in 2016, we had property donated to us just south of Firehouse Liquors and Copy Motors in Hinckley, right on Highway 48 there, if you're familiar with the area. It was donated by Family Dollar, so we affectionately call it the Family Dollar property. We are looking to develop that property, putting in full infrastructure, water, sewer, storm sewer. And we are currently talking with a developer out of Duluth to do 80 workforce housing units, apartment units. And then we are also working with the developer, Summit Development, which is doing a senior housing property in Pine City, just south of the courthouse. We've been talking with him about doing a property in Hinckley as well. So we are preparing to make about a $3 million commitment to the infrastructure for that area. Decided to move forward with design and engineering. That would be required to get all of the utilities in there. The map has actually showed up on screens behind you and over to your left here. So we asked the county board if there were economic development board, if there were funds available through the county's ARPA. So they can help us pay for the design and engineering costs. We asked for a $25,000 commitment from the board. It went to the Economic Development Committee meeting on the 8th. I believe they recommended approval. We are here tonight, or this morning. Sorry, I'm used to evening meetings. We are here this morning to ask the board for approval of that contribution towards our project.
So out of that, they're going to be putting the initial cost of the $200,000 to go towards that. And then we'll be, they're asking us for the additional $25,000 to cover that feasibility study.
Yeah, we had planned to move forward with this through the winter of 1920. And then COVID happened and we lost 20% of our water and sewer revenues, which really hit our finances pretty hard. So we had to put the project on hold. Casual conversation with the engineer this summer, everything went up. So now it's $10,000 more just to do the same work last year. So we figured, why not do the engineering work now? We know the cost, we can handle that. And then we can hopefully have a shovel-ready project to look for additional funding, be it from the state or from HUD or something like that, to help us make the full contribution, the full project work.
Mr. Chair,
Yes,
I think that's exactly what those funds should be used for, is infrastructure that help improve that.
I do too, and I wish you.
I think it's
in a world that you can get a project in there as soon as possible. We all know housing is the issue we hear about continually.
Yeah, the workforce housing and then senior housing are the two biggest issues in Hinckley and at the county as well. So it's really geared towards hitting a need, not only locally, but in the county. Our best case scenario plan right now is we will probably, hopefully be digging in 2023.
They take a long time. That project that they're now putting footings into south of the courthouse was, how long, David? They were gonna be they were gonna be digging the last year and the year before, I mean, they just take a long time. But they're big projects, and so.
The sooner we can start, the sooner we can
Right.
get it in the ground and get it finished and reap the rewards, so.
Thank you. Does anybody have any more questions? If not, I believe we need a motion to move
I will make a motion to give the city of Hinckley $25,000 to go towards their feasibility study for this plan.
I would second that.
And Mr. Chair?
Yeah.
I think Leslie Sauter has some comments as well, if you would.
Oh, Leslie, do you want to chime in here? Sorry.
No, you're good. I just want to say that I get contacted pretty regularly by developers looking for land that is ready to be built on for housing, whether it's single family, multifamily. Senior housing hasn't been hitting us up too hard. So a project like this could be supported pretty quickly if the infrastructure and the road is in. So I want to just say I support this project too, just from that aspect that I think we could fill it up fast.
Thanks, Leslie.
And there's property, the majority of the property we own, there's 2 parcels that are freeway adjacent that are privately owned that benefit from this as well, because they would gain access, not only road access, but water and sewer access as well.
Thank you. Any other questions from the board? Otherwise, we've got a motion by Ludwig, second by Waldham, or a motion by Lovegren. No other questions? All in favor, say aye.
Aye.
Aye. Opposed? And thank you very much. We're
Thank you for your
working hard.
Should I go through with the rest of the report?
Yeah.
Okay, so that was a big part of the conversation, was the city of Hinckley and what they're planning on doing. We also have Extension who's looking for some money. They want $75,000 over 3 years, but I think that they were going to be here to talk about that in a little while, correct?
Next board meeting there.
The next one, okay. And then we talked about the building rehab program. There's 3 homes and 6 commercial applications. A hotel in Finlayson, sports. We just talked about the applications that were coming in. And in that, it was decided that they should continue going as they have been and looking at the applications and figuring out if it's the right projects to spend that money on. We talked about hometown fiber, and one of the things that we found out that hometown fiber did that was really big for me. We were told that all of that fiber in the ditches, that we can't touch it. And they're saying that we can touch some of it. So, I mean, that's going to be huge. We may be able to get fiber to homes way faster than we were thinking that we could with that accessibility. And there was a map, but it's not in here, that shows where the fiber is. And we have a lot of fiber in our ditches. So that was exciting. On the back of this paperwork, there's a sheet in our packet that has what money has been spent, what's been approved, what's on hold. So if anybody wants to know where they're at or where we're at with ARPA money. Anything else?
I'm not on that committee.
Okay. I think that's-
All right. Thank you.
Yeah.
We'll move on, Health and Human Services Advisory Committee.
I'll take that, Mr. Chair.
Yep.
We had our meeting November 9th, which, and I had made a request to learn more on that banked bed issue we have, and they, Pat Meacham from Health and Human Services did a nice job, kind of filled me in. So what that bank beds thing is, and we've talked about it before, is it's a leftovers from when the Cambridge State Hospital closed, and Pine County had access to funding of 16 beds. And it's not really the catchment dollars either. It's a separate thing. You know, the catchment things like from Moose Lake, whatever, for emergency stuff. This is just like a housing type thing. So the county, the Department of Human Services did some outreach with residential group homes and things like that. And they're trying to figure out, and we're still trying to figure out how we can leverage those bank beds, that funding thing, into housing projects. So the question then is, can you mix it with general housing? And absolutely, you know, these are people that can get along on their own. So if there's a housing project that gets put up, we could stick apart, 16 of those apartments in a housing project could be used for whatever number that we can get, can be used for that part of it.
That's awesome.
I know, it's kind of amazing, isn't it? Yeah, and it's for a need of people,
Right.
but that are higher. So that's a good, I learned, I don't know enough. We never do, but we have to keep learning. But so I thought that's a good bit of information, I think, for the Economic Development Committee too, when you're, that's at least a little bit of help to have those projects. So, then we had an update on the Region 7 Dental Coordination Program. And I don't know a lot about this. I know we talk about health and human services, but the Blue Cross Blue Shield has funding for a regional dental coordinator. And the position will be housed in Isani County and focuses on expanding dental services in the Health and Human Services Department, who dentists don't typically accept medical assistance because of the rate of pay. And I think there's a change in the law that I think is trying to bump it to a 98% or something like that.
Yeah, they cost. Apparently the rate has changed significantly.
Yeah, the rate.
So
it was so low before that it was.
If I understood it right, this person's job is to do outreach to dental clinics, so we can get some dental clinics in East Central Minnesota that would accept that dental insurance.
I know, and I think right now there's just like Deer River, and everybody has to drive.
Yeah.
And they're so busy, it's hard to get in, and we all know that your dental health is, for these kiddos, is leads to a lot of other health issues, we know that, so it's I don't know a lot about that program, but so questions should probably go to Becky if you have.
Becky's on there. Does this have to do with the dental mobile too that goes around and does dental work throughout the areas?
So sort of, right? It's all connected. But what we see is counties like Pine are doing some county funding, using county dollars to bring dental mobile clinics to their agencies to help serve the underserved populations. And so the goal eventually is to make sure that many dentists in the area, local dentists, can build up their MA population that they're serving, especially now with an increased rate that goes into effect January 1st, 2022. And so we'll still be doing the dental clinic to the Sandstone, the North Pine Government Center through next year. But the goal and the hope is to have our own local providers to take on more patients and get the rate of pay that's necessary for them to do business.
Okay, thank you.
Thanks, Becky. And then we have a little more. So then we had updates. The move out of the South Pine Government Center is complete. And I think everything's been handed off to the city of Pine City. So we have nothing to do with that building anymore. There was interviews held the week prior to our meeting for a part-time veteran service position to assist. That's a busy thing. And a busy thing in our county. And I hope it gets busier. I hope we get some of our clients that have went to other places to start coming back here. And I don't know if that's happening yet, but maybe we get Mindy to at some point to give us an update. Most of the HHS positions open recently have had multiple qualified applicants, but the adult protection worker positions have been the most difficult to fulfill for the adult side. So it's hard to get someone to fill that adult protective services position. That the healthcare assistant budget, it's overspent for the child assistance budget. And historically we overspend it and we use surplus funds to cover it. So there's a need in that thing too. I don't understand all that. And then the other thing was those ARPA funds. We approved those mini grants for the Help Those Pro. They're starting to roll out now. And hopefully we see some results. We approved them last week, I think, or last board meeting, I think. And so they're getting right to work on those, and hopefully we'll see some results on that. And our next meeting will be in February.
Thanks, Matt.
Yeah.
Covered it well. Do you have anything to add, Becky? Did we forget anything?
No, if I could just touch on the veteran services, we are getting some of our local veterans back being served in Pine County. And really, Mindy hopes to expand and do more outreach in the Pine City office. And so we're really looking forward to getting that other part-time VSO on board so we can really provide excellent outreach services and do veterans in Pine County do them proud, do good work for them.
I'm always reminded of that number. They're a significant part of our adult population.
It's a big number.
It's like almost 2,500 vets in Pine County out of a county of 29,000 some. So we're looking at 8%. And if you break that down to adults, you know, it's way over 10. So Mindy's done a marvelous job and we're very happy with and proud of what she's doing. We know she needs help. And so I think we're going to onboard the part-time person soon, right, Becky?
I do have questions. Becky, maybe you can stay on too. So I was talking to a vet at the post office. And, you know, I asked how it was going and he said, you know, a lot of our vets, the older vets won't go seek help just because they're too proud. They don't want to be a burden. And I don't know how we, you know, they're suffering, some of them. And I don't know how to fix that. How do we do outreach in that group?
I think I've seen a change, Matt. It's completely just anecdotal, but as people have had a good experience in Pine County, and then they've gone to Veterans Services, and I'm most familiar with the one in St. Cloud. They have the most awesome healthcare system in the world. And they really, people come back and talk about that. And so it's not so frightening for people to think they have to go to St. Cloud. I was just talking to a vet yesterday about, they seem to be very good about putting you, instead of making you drive to St. Cloud 500 times, sending you to a specialist closer to where you live. You know, they can do that. They can authorize that. And they seem to be very good about doing that lately. So that I think has helped.
Mm-hmm. I'm just familiar with this kind of guy because my dad was one of them. He was a Korean War vet and he would not go to vet services.
Well, it's come a long way too. It used to not be as good as what it is. You know, the services at the VA wasn't as good. And I mean, it was, you know, horrible experiences where now you're getting the better experiences. I mean, they've come a long way. So I think that that's going to make a difference too.
I really think, I tell people they must sit everybody down at St. Cloud on Monday morning and say, if we ever hear that you're not kind to somebody, you can't work here, because they are the kindest bunch of people ever. The other thing I've heard from some of the providers is they've chosen that place to work at because they have a family member or something that is a vet and they want to make a difference. They could work any place, but they choose to work at the vet's hospital. And they're good. So thanks, Becky.
Yeah, thanks, Becky.
I think now it's time for Essentia Health's report.
Morning.
Hi, Joe.
Morning, Joe.
For our annual report, as far as ambulance operations for Essentia Health for our Sandstone operations. So just to review our EMS operations, we've combined into one EMS company last year. So we're part of our larger EMS company, which has 6 locations throughout northern Minnesota. Sandstone responded to 3,710 requests, which was about a 5% increase over the previous year. This is for our fiscal year. So our fiscal year is July 1st through June 30th. We operate out of 3 base locations and we have an extremely large service area of just over 1,300 square miles that we cover from our Sandstone operations. So about 40 miles of I-35. And if you combine it with our Moose Lake operations, as of August of last year, we cover probably 95% of Pine County between the 2 different operations. So our 4 base locations. For our Sandstone operations, this is an outline of the PSA that we cover. So we cover the vast majority of Pine County. We also go over into Aiken County and Kanabec County as far as the areas that we serve. And then the northern part obviously is covered now by our Moose Lake operations. So we have a assistant medical director out of Fargo that specializes in emergency medicine. Like I said, 6 operational sites. We have 2 educational programs. We have about 130 EMS clinicians when we're fully staffed. We do have community paramedics in Brainerd and Fargo, and we're looking at expanding that program to some of our other locations. Total EMS wise, we respond to about 12,000 calls a year and transport about 9,400 patients. As you can see, our service areas are listed out. Pine County, our Sandstone operations is obviously by far the largest geographical location that we end up having. We're on the right side. So what have we done over the last year or so? We, as a system, we purchased 3 ProMaster ambulances. They're the van style. We have 1 in our Sandstone operations. The reason that we went this route was there's a decreased initial cost, decreased maintenance costs. They get a lot better gas mileage. They're mainly used for interfacility transfers, so hospital to hospital transfers. They provide a much smoother ride. If you've ever ridden in one of our ambulances before, they're not the smoothest things in the world. They're on a 1-ton chassis or larger chassis, and the patient sits directly over that rigid rear axle. So these provide a much smoother, much more comfortable ride for our patients. We utilize them as backups. Each one is about $130,000 versus about $200 and some thousand for a new box style. Operationally wise, gas mileage, our boxes get about 6 to 8 miles per gallon. These get about 16 miles per gallon. So it's a lot more economical that way too, to try to keep those costs down for our patients. We've added new adapters to our King Vision video laryngoscope. So if we have to insert a breathing tube into somebody, I mean, video is the way to go versus the old school style with the laryngoscope. We've added pediatric capabilities. They just came out with that this year or last year. So we've purchased the adapters. So now we can use a video laryngoscope on everybody from an infant to an adult, versus before they had to be a large teenager to an adult before we could utilize it.
That's awesome.
So they're not cheap. It was about a $20,000 investment for the operations down here, but much better patient care. We're updating our armor radios. So we're working on getting them programmed right now. We purchased a total of about $140,000 system wide. $55,000 of that went to our Sandstone operations to update from the previous Motorola version, the XTL and XTS versions, to the APX versions for our communications. Recruitment. So this is bane of every business out there is trying to get people. With that, we've awarded 8 additional $7,500 scholarships to our current EMT system wide. There are a couple of them over in our Sandstone and Moose Lake operations to take our current EMTs, pay for the majority of their schooling to become a paramedic. In return, they guarantee to work for us for a couple of years. We're also implementing sign-on bonuses of up to $7,500 to try to entice people to come and work for us. Besides the operations, it's just, the whole issue of trying to find people is difficult in every job. It's nothing different with us.
Have you been to where you're short on paramedics?
Oh, we're short right now, yeah. We have total out of the 130 positions, we are short system wide in our EMS operations, about 45 spots open. Wow. Between EMTs and paramedics. And that's pretty much nationwide, statewide, down some of the larger services down in the cities, they're 50 to 100 paramedics short. Hennepin County, I heard, just changed their ordinance 9, where every ambulance that responded to an emergency call in Hennepin County had to have 2 paramedics on board. they just changed that or will be changing that to they're allowing an EMT and a paramedic. Just because of the lack of trucks, lack of ambulances available within the state.
Do you think it's the nature of the business or it's just people don't want to go into the business? That's not the same thing. I mean, that like
I think,
working nights and all that versus the.
you know, with the newer generation, I don't think, you know, we're trying to get away from any call time in Pine County. We don't have any call time because that's a deciding factor for a lot of people. I think it's just, you know, the nationwide staffing shortage for any part, including healthcare. I mean, you look at any healthcare websites, there's lists and lists and lists of nurse jobs, phlebotomy jobs, x-ray, everywhere. And part of it, I'm sure, has to do with it's not a Monday through Friday, 8 to 5 job. I mean, we have to be available 24/7. So you have the nights, you have the long hours. Our working environment isn't as nice as a hospital environment.
Is that where you lose them?
Because, yep, hospitals are, as they look at their staffing models, can they bring in more EMTs and paramedics into the hospital setting to help offset their nursing shortage, to provide that care? So then they take it from our area, pre-hospital medicine into the hospital. There's no ditches, there's no 45 below wind chills that you're dealing with when you're working in an emergency department. Helicopter services are expanding. And so we're Lifelink's expanding, putting another helicopter base up in Northwest Minnesota. So that may impact some of our staffing up there. Yeah, the fear is burnout. I mean, it's real, it's happening. We're trying different ideas on resiliency tips, you know, making sure that our crews do get rest if at all possible and trying to maintain. But then on the other hand, our volumes are going up too. And I can go over some of that here in a little bit too.
Thank you.
Yep. So first responders, and this is the key to EMS in any rural Minnesota area, is our network of first responder groups. Because if somebody needs medical care, you know, it's not always the ambulance needs to be there to provide that or initiate that care, especially in an area geography this large. It's our first responder network. We're very lucky in Pine County to have deputies that are first responder EMT trained and very willing to go on medical calls. That's not necessarily the case in a lot of counties, especially behavioral health calls. A lot of counties have just started refusing to go on behavioral health calls. But that's why we started working with our first responder groups and making sure that they're trained, making sure that they have the equipment that they need, because they're our lifeline as we have staffing shortages, is getting that care out to them. And if it, you know, they're the ones that are going to make the difference on those life and death situations. They're the ones that are going to put a tourniquet on a bleeding wound, even if it takes us 10 minutes to get there on the ambulance. That could be detrimental to that person. But if they have a first responder there within 2 minutes and they can tourniquet a bleeding wound, that's going to save that person's life. We get a lot of the recognition. First responders don't get enough recognition, but they're our lifeline. They're the ones that are going to defibrillate that person in cardiac arrest in order to try to regain a pulse. So that's why we started the last couple of years, 2-3 years ago, started working a lot more closely with our first responder groups, providing them training. The only charge to that first responder group is if they're able to obtain reimbursement through Central Region EMS. And if they're unable to obtain that reimbursement, then we write off the cost of the course. So we realize their wealth or the benefit of them having in the area. I was also contacted and I'm playing phone tag with the North Pine Area Hospital District. They want to also discuss some first responders in training, possibility of training, providing funding for training for our first responder groups. So we're lucky that we have as many in this area as we do.
Thanks for doing that. Because those volunteers shouldn't have to pay for their recertification.
And we provide them with equipment, to replace any of their disposables. They just have to contact us and We give them, Pine County will give them Narcan to our deputies to administer. They're administering patients that we're more than likely going to see. And it just makes a difference, especially with the increase in drug use across everywhere. Financially, FY21, obviously we build out about 7.5 million. We write off about 60% of that as contractual allowances. So what we get paid, you talk about dentists and Medicaid payments, it's the same way with us. When our cost of responding or having an ambulance in service, responding to an ambulance call is about $1,000. Medicaid reimburses us about $450. We have to fill in that gap somewhere. Medicare's a little bit more, but right around the same as far as reimbursement wise. And then we had about $234,000 in bad debt. So that's people that can't pay their bills that we end up writing off. Of the 2.7 million that we had in total revenue, we spent about 1.7 on employees, salaries and wages, and also their benefit costs. And we have the other operational items. If you notice on the indirect expenses, which is our cost of overhead for human resources, administration, local administration, our EMS administration, that went down about $170,000, and that's from changing over to having the one EMS company. Our overhead's a lot less than being a department of the hospital. So we have less to pay for, so that decreases that. So we about broke even for last year. Currently, we have one full-time paramedic supervisor. We have a shared EMS manager. We have about 9 paramedics. That ranges from full-time down to casual. Ideally, we'd like to have about 18. We have 17 EMTs and operating FTEs. We operate at about 27.7 FTEs, 28 FTEs roughly right in there.
Is that just here?
That's just Sandstone.
Okay.
Yeah. Responses by fiscal year. You can see it's from FY14, which is way back in 2013 to today. Seen a little bit of an increase up to 3,700 responses. This year so far, it's crazy. The amount of calls that we've had in the first 4 months of this fiscal year. I don't have the numbers on there, but just looking at 911 calls. So out of that 3,700 responses last year, 2,843 of those were 911 calls for service. So far in the first 4 months this year, we've had 1,170 911 calls for service. So if you take 1,170 multiplied by 3, since we're 4 months, it's about 3,500 in 911 calls that we're on pace for. So everybody's been busy. And that can lead to, resource availability and such that there's some questions about. Just a generalized area, this is a pin map of where our 911 calls come from. We provided mutual aid down to Rush City. It looks like 11 times, Harris, Cambridge. We've gone over to Mora, the city of Mora, 16 times, a little bit northwest of there. Again, we provide mutual aid for those 911 calls for other ambulance services in our surrounding area. And they then in turn provide mutual aid for when we're lacking in resources or resource availability at the time. Gone over to Wisconsin a couple times. Just responses by city, just laid out a little bit differently. Like I said, Rush City, what was coded in our system as Rush City, we've been down there 26 times, which is out of our area, more 18 times. And this is only for 911 calls. It has nothing to do with interfacility transfers. Danbury a couple times.
Do you have a reciprocal slide that says how many times the ambulance from someplace else came and backfilled?
I don't have that information because we'd have to get that from the sheriff's department. You track.
We actually, I believe it was under 20 times this last year. From the start.
I got a question. So is that like going to Mora or Rush City, was that bringing a 911 patient? Well, Rush City don't have a hospital, but that wouldn't be, that'd be you responded to an incident there.
Responded to a request for an ambulance.
Okay. I didn't know if that meant bringing somebody to the hospital or something.
Does that happen like when their ambulance is out?
When they're out of ambulances.
They're without a-
service area, they'll call up to the sheriff's department and have the next closest ambulance respond to that. It's mutual aid agreements. It's more of, especially rural areas, mutual or covering for each other if needed.
Do you think it's been reciprocating at all, or do you think it's more you guys are, or?
No, they're coming to help us
Okay.
in times.
Okay.
Like you said, about 20 times, 25 times in the last year. So.
Okay.
Lakes region comes up from they have the primary service area in Rush City. They'll come up and do some calls or, ambulance out of Mora will come over and do some calls if we're out of ambulances.
Okay.
So do you have north and then using air? We also use the air care to in the hospitals that when we're over there. So that helps alleviate that issue.
Yep. For senior responses.
Yeah, we use them plenty for senior.
Yep, so some of that is with the helicopter services with North, Lifelink down in Rush City. We utilize a lot of helicopter resources in this area just because of the rural geography to get those patients, trauma patients, cardiac, stroke patients to a tertiary center, which utilizing those resources then frees up our ambulance because they end up not transporting. So then they're now free or available for the next call. So talking about which hospitals we go to directly from 911 calls. This is what was in our system. So we've brought the 911 patients, a little bit over half, about 53-54% end up coming to Sandstone Hospital. Then the other vast majority, they go over to Welly and Mora and then Fairview. Sometimes we go directly down to one of the metro hospitals, especially if we're going to the Pine City Urgency Center. We treat those as 911 calls. So that's why you'll see Abbott Northwestern and in some of those areas. We went straight to Duluth with 12 patients. Those are typically STEMI patients or heart attack patients or trauma patients that will just bypass and go straight to the tertiary center.
So
I still hear from people, I'm from Pine City. And I think some of it's a carryover from years past, I don't know. That they want to go to Wyoming or they want to go to Mora and they end up arguing with the ambulance driver and end up in Sandstone where they don't know that healthcare system at all. Does that happen or is that?
I have
wives' tale?
I haven't heard of it, but more and more often now recently with the hospital situations, with hospitals being full, EDs are closing. So Fairview, Wyoming, ED is closed fairly often where they go on. There's a statewide system called MinTrack where you can pull up and see which hospitals are open. If they close their ED, we're not supposed to transport there. Sandstone's been closed, Mora's been closed, Wyoming closes fairly often. Then we just try to see which ED in the area that's semi-close that we can transport to, which then, has a ripple effect. It then increases our time on task. So takes that ambulance out of service a lot longer, driving down to Cambridge or over to Burnett County
What takes the ER out of, or the emergency department out of services at those hospitals?
They're full,
Just full,
no beds.
or short staff and can only handle what they have, right?
Short staff, usually if an ED is closed, they're just out of beds.
So how often does it happen? I know my mother-in-law, when she was sick, they started taking her to Wyoming and then they said, we can't take you there. So then they started for more, and this was a while ago, so they probably didn't have as many computerized things. They ended up taking her down to the metro area because everything was full. They couldn't get.
Everything was closed.
So how often is it? I know that there's more shortages of beds right now. How is that happening? How is that working for you guys trying to do? I know, sorry.
Yeah, no, it's the catch-22. I mean, we have this patient, we have to care for this patient, we have to try to get them. You know, it's the same way with interfacility transfers. Is because there's no beds available in the state. Especially like ICU or med surg patients. We've transported patients that need hospital admission from our hospital in Sandstone over to Crosby, down to Winona, down to St. Croix Falls, Wisconsin. Basically, it depends on where there's a bed available in the state to get that patient, the inpatient care that they end up needing. Or they've held a lot higher acuity patients in the hospital with local regional hospitals because there's no ICU bed available in the state. They've flown patients from Grand Forks Hospital, Ultra over there has taken patients from Nebraska, Iowa, Texas. It's the whole, you see on the news, healthcare shortage, bed shortage, we're overstaffed, we're tired. It's real. There's just no beds.
Is it getting any better now, or is it?
No, but it's getting worse because if you look at COVID today, the data just went up even more for COVID hospitalizations.
When there's a lot of staff that have left too because of the vaccine mandates.
And
So
there's
it's short on
staffing shortages. So a lot of the ICUs have to do with staffed beds available, not necessarily beds available.
Right.
But if they can't take a patient, they can't take a patient.
You always think of the hospitals and stuff that are dealing with that, but I guess I never wrapped it around with the ambulances.
It all ripples down to us, the same thing with, we talk about availability in the area. If we have to take patients on 911 calls farther, or we have to take patients that originate in our hospital a farther distance than what we normally would, going down to Rochester. Behavioral health patients is what our hospital has done in Sandstone is we've used an outside resource for a lot of behavioral health patient transports, which are typically a lot longer. They typically go Marshall, Southwest Minnesota, Fargo, Thief River Falls, every now and then to Duluth. But we use an outside contractor for that instead of utilizing our ambulances in order to keep our ambulances more available within the county itself. Otherwise, they do about,
It's a shift.
200 to 300 a year behavioral health transports. That would add and tax our system even more. The thing is, they absorb that cost because Medicare, Medicaid, they don't reimburse for that outside resource, whereas they would for an ambulance, but it's the best thing for our service right now with staffing.
Can that be relooked at? With the shortage of the EMTs and the shortage of paramedics, can it be looked at that medical assistants would start doing some of those outside? Is that something that can be promoted more to get help where that will be paid for?
The behavioral health transports.
Yeah.
There in Minnesota, there is a classification for special transportation called protected class. That was an answer to Minnesota Medicaid as far as the ability to utilize non-ambulances to transport behavioral health patients that is reimbursable by Medicaid. Problem is there's no one available here, and they put a 100-mile radius on it for a single person transport versus if you go over 100 miles, then you need two people. So if you're gonna need two people and you're gonna get reimbursed $75 versus an ambulance where at least you'll get $250. Cost benefit isn't there for somebody to start up those businesses. Some counties have taken it upon themselves, like Itasca County, where we have an ambulance service up in Deer River. They actually started the protected class transport internally within their county to provide those transports. They operate, I think, 3 vehicles now to do those protected class type transports. Everybody's trying to think outside the box on how to make things work with the staffing that we currently have. Just put this on. This has the last 3 fiscal years. Everything's pretty much consistent. We know when our volumes go up, when they go down, there's a little inconsistency, but overall it's pretty much the same. And this is the amount of times that, so over our overall responses, 73% of the time we end up transporting a patient from that scene to the hospital. If you look at the whole numbers, 16% of them refuse transport or don't want transport to the hospital. And that's the area that we can work on. You know, if we can minimize that amount of people utilizing the 911 system for ambulances, you know, it's going to create 16% of the time going to increase our ability to respond to other patients that need transport to the hospital. But we respond no matter what. About 5% of the time we're canceled before we get to the scene. And then obviously we have some patients that are deceased that we don't end up transporting. 32 times during last fiscal year, we transferred to another agency. So that would be the helicopter scene landings, where we transfer that patient over to those helicopter providers. 12 times law enforcement transported. I don't know where they exactly transported, but they transported. All right, Matt, questions?
No, I think I did have a question, but I think you kind of helped explain it, which my question was I'd heard where your ambulances, say you're doing a run and you're coming back from the metro and then there's a call that comes out where they need like in another city before they even get into back in your area, and that our ambulance might take that call with very longer because they're short somewhere else. That type of thing adds to the problem too. Yeah, how often are we without an ambulance? At least one in Pine County.
So previously, when we were dispatched by Alina, that would happen. Now, nobody south of us knows that our ambulance is even in the area.
Okay.
Because they don't have our tracking system. So that doesn't happen anymore because we're not dispatched by Alina any longer. We're switched back over to the county a year and a half ago, 2 years ago. Somewhere in that time frame. September sometime. The only time that we won't have one ambulance in our PSA is if there's an emergent transfer, because we treat that as a 911 call. So if there's somebody having a heart attack that needs to get to a cath lab to open up that vessel, we treat that as a 911 call, even though it originates at a facility or at a hospital. Otherwise, we have one in the PSA or has responded to a 911 call in our PSA. Like I said, the only time that we pull that last resource, not saying that they're available, but they might be on a 911 call. So that's where we'd go to none available, but would be is for those emergent transfers. And that's typically only if helicopters can't fly also. As we'll refer, we've gotten more stringent on what we consider emergent, what the hospital may consider emergent and what we consider emergent on the ambulance side of things are two different things. So ours is a lot more stringent than what the hospital has, and we go by what our rules are.
Okay. Thank you.
On your question on your,
That,
whoops, sorry.
go ahead, JJ.
Okay, if I can, question on your equipment, your ambulances, looks like quite a cost savings and significant mileage. What did you give up, if any, performance wise compared? I mean, your speed and the speed of the ambulance, reliability, anything? I mean, what's the difference there? Have you noticed or do you know?
The only real difference is just the amount of space, physical space in the back of the ambulance. All of our equipment that fits in the big square boxes fits in one of the vans. So there's no loss of equipment. Usually what happens with the larger ambulances is there's an empty cabinet, and somebody needs to shove stuff in there.
Yeah, yep.
They're just not, you don't have full 360-degree access to your patient as you do in the box styles. So that creates a little bit of an issue because you're not able to easily access the right side of the patient, which is why we want to maintain box styles for our 911 responses as much as possible, unless they're down for maintenance. But realistically, it's a win for patients for the transport, and they're comfortable. They have actually more room up front that our crews can lay their seats back and take a nap on their way back from a transport. More so than in our box styles even.
Sure.
And one other thing we did do over this last year is we hired a mechanic for our ambulance fleet system wide. So you might see a little white ProMaster with a box on the back that says Essential Health on the side running around the county. That's our mechanic. So he does on-site maintenance of all of our vehicles, so we can just get a little bit better grasp and have better preventative maintenance than trying to outsource it.
Thank you.
My question is kind of the same that Matt had, because we hear things, and sometimes we hear things that happened 2 years ago. But the thing I hear is that these ambulances are gone, and now we don't have any coverage in Pine County, and Welly is supposed to be covering, but they're not, they're nowhere to be seen, and I don't know if that's a myth or a wives' tale, or, I mean, do they physically come and put a box in Pine County if we're all gone?
I don't know
If they got one, they will.
So one way we're looking at addressing some of those issues and concerns too is we just got approval last 3 weeks to staff an additional 18-hour truck up in Moose Lake, which would be a roaming truck more so. So if we're short on ambulances down here, that ambulance comes down to this area. Denise and with the sheriff's office and Carleton County Sheriff's Office, we're working on some logistics as far as awareness between the two areas on how we can increase those communications so that all 4 of our bases along the interstate know what the other 4 bases are doing. So we're actively recruiting for additional staff for that truck. Which then it would be an overnight, so it adds an additional overnight resource for down here also. And if there's a transfer, their main job is going to be responsible for interfacility transfers to keep our other 3 staff trucks in Pine County available for here. Now, obviously, we have to try to find people for those. So if you know of anybody, we have paramedics, we have a sign-on bonus, so.
Moose Lake always had 2, so you have 1 now there? Because they used to really help us on the north.
Moose Lake was staffed, they had 1 paid staff, and then they had volunteer staff that would respond as needed to calls. When we took over, we actually put a paid crew up there, and then we were utilizing the volunteer staff to staff that second truck. Oh, well, the volunteer staffing level has been decreasing. Nobody wants to be on call, stay within the city for $4 an hour. It's just not the way of the future. So that's when we came up with that got approval, put together a plan to add that additional 18-hour overnight truck up there, because down in Pine County, we dropped down to 2 trucks from 1 a.m. to 6 a.m. typically if we're fully staffed. But that would then add that additional resource for both areas.
I appreciate what you're doing, and I think we all know that live here know how big Pine County is. So if an ambulance is sitting in downtown Hinckley and they got the engine running and the crew is sitting in it, and I call 911 from a 1.5 miles east of Pine City, you can't get there in 2 minutes. I mean, it's just the way it is. And
yeah, I mean, if we could add more staff, if we fully staffed, we're at a volume, I think, where we could look at adding additional trucks down here. But if we don't have the staff right now to staff our 3 current trucks, it's just futile to look at trying to add additional ambulances if you don't have staff to staff your current ones. And luckily, we're able to draw from our other areas to come over and staff. There's been times when we knew that we were going to be down a truck, down to basically 1 truck in Pine County. We had extra trucks up in Deer River where we can move them around, or at least pull that staff down here from that truck and just go down to a couple trucks there and then in order to increase down here.
So I have one more question. Yep. There's probably more for Jeff. How many first responder groups do we have left up and down the, 23? And it's like, is Carrick and Finlayson and Willow, are they still active first responders, all of them?
Yeah, some have scaled up and down over the years.
Yeah.
From what you probably remember, but they, I think have become more active, the ones that are out there, and more willing to respond, so they're more committed to it.
so
But like most volunteer stuff, it's a struggle to get new blood and that involved.
Are we meeting their needs, so is it something I can raise at Central EMS, that's what I'm asking.
I don't know that I have an answer.
Don't get much.
I think they have more needs, so if you have more.
Oh, I'm thinking, first of all, the recertification, which we can reimburse until the fund goes out, which when that happens. But there's more money allocated this year.
Yep.
Yeah, so.
are the fire departments included in the first responder groups?
Yeah, typically.
They are, except for Pine City, as Pine City EMS, which is separate from the fire department. So basically, we have 11 first responder groups in Pine County, which that's awesome. And I know each of them is growing, and the recertification has been happening.
See, and I don't understand the whole politics behind the fire departments. They should just have the firemen be the EMT too, because typically if they go, they used to operate out of the fire hall. Well, they got nothing. But if they could coordinate with the state, the MSRB or wherever that thing is down there, and because those firemen always get a stipend.
Well, they get called to everything.
I know.
I mean, they're there.
And why not have them just meld together, the first responders and the firemen, which is easy for firemen to keep up with it because they need it anyway. Then they could help, it might help that whole system. So instead of putting those volunteer first responders that all they do is some go from their home, they keep the kit and they get the radio call and they're taking care of the patient, but they're just doing it out of their goodness of their heart, So that's not a fix for you, but that's something we need to figure out how to fix.
I know the first responders that I know, they love to help their neighbors. We're very blessed to have them because their hearts are just everything that they can do to help their neighbors and their neighborhood and their community. They're right there and they love what they do.
There's a lot of our firefighters that are cross-trained that have both sides of it. And I think it's been more prominent in the last probably 4 to 5 years that we're getting the first responder, just alone first responders that are starting in with the fire departments that aren't firefighters. But most of our firefighters are.
Yeah. Yeah, I think.
Thanks, Joe. I would.
Mr. Chair, I'm
Yes.
wondering, every year this is an interesting conversation and it's just kind of information comes out and we can see how the industry is changing. I'm wondering if there is maybe, if this would be a topic that should go to the Public Safety Committee, maybe sometime in the new year, and really have a little more in-depth conversation if Joe was willing to do that. Just to better understand, what the pressures are, what the future looks like, and who all the players are and how those are changing over time.
I think
That's a good idea.
I think that's a great idea because a couple times in our life, maybe, we're the guy calling 911 and we want somebody to show up before we hang the phone up. I mean, it's an emergency or we don't call 911
Well, if it's a good idea, it would bother me that I not credit it to Sheriff Nelson who suggested it.
Oh, funny.
Well, the calls are just gonna keep going.
So-
Waiting if it was a good or bad.
So I have a question, and maybe
Yes.
this is the wrong place, and if it's the wrong place, just, but you had mentioned that there's another county that has transports by the county for the mental health issues. And I'm thinking we have Larry and is it Heidi, correct? That they would do transports, but with COVID, those transports have cut down for them, haven't they? Would we be able to utilize that kind of a transport to help transport some of our mental health people to open up the ambulances for more 911 emergencies? Just a thought process, think on it. We'll go
I
to-
think that's the kind of thing that
Yeah, that you
if
can
we
talk about
send
at
it
that
to our
meeting.
Public Safety Committee,
Yeah,
that would be a first good topic to,
It's really hard to find beds for them.
I know.
well, that's
Like he was saying, they're.
that's why it takes so long.
That's crazy.
Yeah, the EDs do have a special. So the emergency departments can close, which means they don't want any ambulances coming, or they can just close to certain patient types. And behavioral health is one of them.
Mhm.
So if the ED, and it's to keep resources available for patients in the area instead of having, like Sandstone, the 5-6 beds in the ED, instead of having 5 of them filled with behavioral health patients that can be in an ED for 96 hours or longer, trying to wait for that. So I mean, there's benefits to it too. It just getting ripples down and makes us go further.
Thanks, Joe. I appreciate you being here,
Thank you.
taking our questions.
Thank you for what you do.
Okay, we'll move on to the old Shangwatana final plat.
Mr. Chair,
Yes.
members of the board, before we begin, just to clarify the addition to the agenda, there's the addition of the maintenance agreement, which is not obligating the county to anything. And then we're recommending that we do a separate agreement with the developer and the county for the notice piece. And that maybe didn't come across clear when the addition went out. Is that what we're thinking, Caleb?
Yeah. You could share the screen. So I'm Caleb Anderson, the manager of the Planning and Zoning Department. This is the third plat that I've participated in at the county. The process is 3-step, essentially. There's a kind of a sketch phase where the developer kind of just lets us know what they're thinking, and then there's a preliminary plat application, at which time there's a public hearing held with the zoning board. We hear from the neighbors, we hear from the DNR because it's a shoreline property. There's they kind of weigh in on state interests. That was approved back in August of 2020. The original submission was in July of 2020. There were revisions that got approved in August. One of the unique things about this plat since I've been here is the construction of a road as shown in the southwest corner. The ordinance, subdivision platting ordinance is written such that once the preliminary plat is approved, the developer is essentially to go ahead and build out any infrastructure
It's to be inspected along the way by the township and county engineer. They kind of certify it upon construction. And then we have an application for final plat that goes before the zoning board. That happened, originally it was on their desk in September. It was identified by the county engineer that the road didn't have quite the correct radius. So that got corrected by the developer, and in the October zoning board meeting, they basically said this plat meets all local ordinance requirements. The township has then also executed a agreement whereby, because it's a private road and the language is subject to some interpretation, but essentially we've arrived at private roads are allowed within the ordinance. Still need to be built up to spec though. So the agreement has been executed between the township and the developer such that the township can inspect the road and the stormwater pond, which you can hardly see on this, but it's off to the west side of that cul-de-sac. And if the development fails to maintain it, the township has the authority to do that and assess the maintenance costs to those affected parcels. So it's been quite a dance between all parties to get to this point, and I think we've arrived at a good development that meets all requirements. It's been thoroughly looked at and revisioned along the way. So we're recommending approval of the final plat. And also, I guess that agreement between the township and the developer, we were added as a signatory. But really, it's almost just an acknowledgement on our part that process of the township inspecting, doing that work, we really would not be a party to that. But acknowledging that this planning document is a good step to protect the overall development for future owners down the road who may have issues. So that's what I know. Any questions for me?
So why wouldn't the township just take it over once it's done? Or
they maintained that they wanted to see the road connected to Scott Drive.
Okay.
Which terminates, which is not, it's a public right of way, but not adopted by the township. And
because that's all private on that side too, right? Or
it's a public right of way, privately maintained.
Okay.
On Scott Drive.
Yeah.
And you'll see that wetland boundary kind of complicates that factor, where it comes right up to the edge of that Scott Drive. So that was one of the complications. And also, it was just kind of a rocky start between the developer and the township. And I think the developer, my interpretation is they kind of lean towards, let's do this privately because it doesn't look like we're gonna agree here.
Matt.
I will move the old Chingwatana final plat. I've been listening to this thing for a long time.
I will second it.
Not today, but up through the process.
Yeah.
Yes.
There's a lot of work went into this.
Yeah.
Did you second that, Terry?
I did. I have a comment too.
We have a motion and a second. Is there any comments, questions?
I don't know if you heard last week, but Matt had brought up how amazing your team is. Your zoning board, you've got so many different ideas that come from so many different areas, and they're so thoughtful and they process it so well. And I've been sitting in on them too, and this has been a hard one for them. And they finally said, you know what, if they meet all the qualifications, and we need to let the township say yes or no at this point. But you do have an amazing team.
Yeah, they
all have.
I wanted to make sure that you heard what.
I know, but
that you heard what Matt said.
They deserve a shout out because
Yeah.
they worked pretty hard. There's some good minds grinding on stuff.
Yeah.
I appreciate what both of you are saying, because I think I think we've all probably said it at one time. If we got to this point and said, we don't like what you did, we would probably, I mean, are we gonna then reappoint a new zoning board every time we disagree with them or question them, or,
Yeah.
you know, I believe they've done their homework
Well, and we did disagree with them on that one issue a couple months ago, and I think that they liked the fact that it came back because then we
Yep.
started seeing other things too.
Yep.
But, yeah, it's just so diverse and they come together so well.
Yeah, I hope you bring it back to them because they thoroughly vet everything that gets in front of them. They don't just push it through. So that's a good thing.
Yeah.
And you do a good job of keeping them all going too. So, yeah.
Thank you.
Any other questions? If not, all in favor, say aye.
Aye.
Opposed? Subdivision approval resolution of 2021-70.
Mr. Chair, members of the board, I'm Kelly Shutter, County Auditor Treasurer. So before you today, you have a resolution in front of you, which is actually a change in the deed recording process. So right now, when a deed is presented to us for recording, we have a checklist of things that we look for. I mean, does the person own the property? Are the taxes paid? Those types of things. One thing that we cannot look at currently is if it's subdividing a property. So not a plat like you just heard, because that's a whole process on its own. But if I'm just taking a 40 and splitting it into two 20s, right now we can't look at, did this split get approved by the zoning office? We just have to move on with it. And then after the fact, the zoning office, or we have a handful of townships and cities in the county that do their own subdivision ordinances. Then after the fact, those jurisdictions have to look at that. Oh, this works or it doesn't work, and figure out what they're gonna do about the fact the ordinance wasn't followed. So recently I had conversations actually with both Arna Township and Royalton Township with a concern about this. And Arna Township, those of you that know Bob know that he digs. So Bob found this statute that actually allows jurisdictions, township, cities, counties who have an approved subdivision ordinance to simply pass a resolution that requires that the approval be attached to the deed. And so it seemed very simple to me. Arna Township went ahead and passed this resolution last month. My first response was, how the heck are we going to remember that Arna Township has this requirement when they have about 2 splits a year? Which was what prompted me to stop and think, well, if we have this subdivision ordinance, our zoning office is working so hard to enforce, why wouldn't we support them in that? And so it made sense to me to bring this forward for the county to consider with our subdivision ordinance to require the approvals to be attached to the deeds. I had conversations with a handful of local attorneys and title companies who process deeds, and all but one had resounding support for it. They said, we're already doing that, making sure we get the approval. So it's not any big deal for us to simply attach it to the deed. And actually a couple of them even responded that that would actually save me a lot of time in the future, because then I don't have to figure out if the split or the subdivision was properly done, because it's right there attached to the deed. The one dissenter thought that it would be a significant amount more work for him, which I followed back up and said, I'm not understanding why. And I didn't hear anything more. And so, I would think that the folks doing work in Pine County are getting those subdivision approvals anyways. And that's what I heard from all of them that I talked to. So that is what you have before you. Questions? Terry probably has questions. This is her wheelhouse.
Well, I'm just thinking that this will really help, because you have so many people, when you stand there and you help people and they're like, well, I'm not going to go through that process. They tell me, no, it's not worth it for me to do it. I'm just going to do it. And if they catch me, they can make me fix it later, and then it's too late. So I think that this is a huge benefit, and it will help everybody all the way around to make sure that it's done the way it's supposed to be done.
Or a family wants to split a 40 into two 20s to their kids, and they're trying to do it on the cheap.
Yeah.
So
well, and I just did it, and yeah.
They don't, maybe their cousin is
way more expensive in the end. Because
Yeah.
then you end up with a septic system that is a type 3 and 3 foot tall clean sand mound because you didn't check to make sure the lot could support a septic system, and you end up with legal descriptions that aren't correct, where the minor subdivision process, if they actually go through it, our county surveyor reviews the legal description. It's a good process. It's not just there to make people's lives hard. It's there to make sure we're getting good lots that can support building and can, are properly done.
Did anybody give a if I'm gonna split a 40 into 220s give them to my kids, is that gonna cost me an extra
Yep.
$40, $80, $500,000?
So the minor subdivision process is $150.
Okay,
But I mean, you should be doing that either way.
right.
So our ordinance does not apply to any splits that are over 40 acres. So if you have an 80 and you're splitting it into 240s, it doesn't apply. And so Caleb has made a handy form that the title companies or attorneys can just get that says this subdivision, the ordinance doesn't apply.
Okay.
So that's something that they're supposed to do, but this is not going to cost anybody any more money because it's going to be attached to the deed, which has the same recording fee.
Correct.
Seems like a no-brainer, doesn't it?
Yep. I'll make a motion that we pass this amendment.
And so I did have it effective December 1st, I've had communication with the folks that do a lot of work here in Pine County, but I just wanted to give them a little time for those closings that are in the works.
A lot of them do it anyways.
Right, they do it anyways.
So I make a motion to pass resolution number 2021-70.
I'll second.
Got a motion by Lovegren, seconded by Moore. Any more questions, comments?
Good job, Kelly.
Not
Bob.
all in favor, say aye.
Aye.
Opposed? Community Development Block Grant Coronavirus Startup Policies and Grant Contracts.
Mr. Chair, I believe Leslie is going to take this.
All right.
Hi, everyone.
Hi.
Leslie Sauter, your Economic Development Coordinator. So back in August, we were awarded Community Development Block Grant funds through the coronavirus program. And we got our contract or grant agreement from Deed a couple weeks ago or within a week or so. So in front of you today are some startup policies and procedures and things just to check off of our administrative list to get the funds released to us. We also posted a notice of intent to request the release of funds. So I am expecting if these get passed and there are no objections and Deed does the process on their end, we should have access to these funds by mid-December, which means a place where you can start hiring an architect to do their plans, and we can hire someone to do the full environmental assessment for the broadband project. So things are moving forward, and if you have questions on any one of these policies, let me know, but they're pretty standard. You may recognize them from a previous Community Development Block Grant Small Cities Development Program grant that you had, but they had asked us to kind of revise these and include the coronavirus language. So it's just a repeat of stuff you've done in the past and is required in order to participate in a Community Development Block Grant program.
Need to act on this.
Yeah, Mr. Chair, you should do a motion to approve them and you can do.
I will move that. I will move to approve those policies.
I will second them.
Got a motion by Ludwig, second by Lovegren to approve these policies as laid out. Section 8. Any discussion, questions? Not, all in favor, say aye.
Aye.
Opposed? All right.
Leslie.
Thanks, Leslie. Yes,
Commissioner Moore missed that vote.
Oh,
So we'll just note that he was out of the room at the time of the vote.
or we could have them vote now. You want to vote yes or no?
I can just stay on it.
Okay, all right. Okay, we'll move on to commissioner updates. Central Minnesota Council on Aging. Becky, are you still with us?
Becky is not on that.
Okay, anyway, has anybody else got this little mailing, this little book?
No.
I'll make sure I get some. These should be available in our Health and Human Services Department, but it's really a pretty good little guide for seniors in all of central Minnesota, but It does list the things that are available for seniors in Pine County. So that comes from the Council on Aging. The money thing baffles me with all the money that's coming out of Washington for ARPA funds and all of this. It doesn't seem like money for things like food support for seniors has followed suit, and there seems to be an uptick in demand and a decrease in the amount of money. So we are seeing congregate dining sites closing because the feeling is most of the people at congregate sites are there more for the social activity and so they've really concentrated on home delivered meals and the frozen meal packages and things like that to help grandma stay in her home.
Are they getting people to deliver it though? Because when they
Yes.
had Meals on Wheels, they couldn't get drivers.
It is also an issue. Volunteers have dropped off. I think they're coming back some now that, I don't know.
Well, that generation is the generation that did a lot of that. And
Well, they've aged out.
right.
They're now the people that are home waiting for home delivered meals and there's nobody there to deliver it to them.
Right. The next generation's not.
Stepping up. East Central Solid Waste. We're still plugging away over there. The amount of garbage that gets delivered to that landfill isn't going down. It's going up. And so we're talking with our engineering firm, and I think in a couple of years, we will actually start the process of engineering the next phase of the hole that was gonna last 10 years, we're pretty sure is gonna last maybe 7.
How many more holes can you get on your site there?
Quite a few. I think we might, at the present rate of fill, probably 30, 40 more years.
How'd you end up with deer carcasses?
Well, they hadn't, by the time when we had our meeting, they really hadn't started arriving yet.
Okay.
Numbers that we could, I don't know. We'd had one dumpster full that came from a processor. That's what they said.
So can I ask a question? I'll wait till you get to the, you want to, okay, so did we find out anything about the deer carcasses that were tested?
Not yet. I was at one of the testing sites in Pine City, and they said it would be 7 to 10 days before they got any results, which would be now.
Okay.
This week.
I'm anxious to hear what they find.
I think we all are, Terry.
Yeah.
But actually, we can talk about that right now because I heard through the grapevine that the governor was actually coming to Pine City. He hunted on a farm in south of Pine City. His real reason for coming there was to look at the CWD testing site. And so the commissioner of Department of Natural Resources was there. Commissioner of Agriculture was there. The chairman of the Environmental and Natural Resources Committee was there. And so that told me they're really serious about this, very serious about it. And they're gonna throw resources at to figure it out. University of Minnesota was there. They had quite a team.
Okay.
I was impressed. East Central Regional Library.
We finally got an agreement that we can sign now for Sandstone so that they can start the process of getting the library moved to the old phase offices. That was the biggest news. That was good. We've been waiting. That's been holding up the whole process, was getting that agreement signed by the library. So, yeah.
Chemical Health Coalition.
So still looking for the directions for the future. Because we don't really have a coalition anymore, we're not part of that grant. We still have a coalition, but we're not part of the grant. We're looking at working to get Pine City and Willow River schools involved. When we had the meeting with the schools the other day, I was able to talk to Willow River School, some of their board members, and they're excited about it. So that was good news. So we've got that going on starting in we're not going to have a meeting in December. We have a jury trial that's going to be coming up in December that's going to be taking a lot of Reese's time, but we're going to start meeting in January. We're going to meet.
Kick off the new year?
Yeah, we're going to kick off the new year, and then we're going to do quarterly meetings instead of monthly meetings. So that's going to be the big change starting in January. And then there's some upcoming webinars that are available for people if they want to take them.
All right, soil and water.
Yeah, they introduced a new, just, Chris Doja. Paul Swanson was absent. Pine County is gonna do a WACA violation over in, Knavik. For them. There was, no public forum. There's just updates of their regular projects. Business as usual, old business, new business. I haven't got the minutes yet. Paul says he'll have them to me by tomorrow. One question came up, it ties into the roofing. There was rubber flapping on the side. I'm sure that'll be addressed when they finish the rest of everything else. And that's it for soil and water.
All right.
Pumping and driving them crazy.
Just kind of turn the meeting and floppity, floppity, floppity.
County School District meeting. I think are pretty well attended by us, so I thought it was a good meeting. I thought Joe did a good job of explaining the Pine Tech initiative.
It's exciting to hear that the schools want to see how they can continue working on doing the scholarships and stuff too.
Right.
I think that's a good meeting to have.
I do too.
I don't know how that would come in, or what I'm about to say would come into play, but you know, when we're thinking of budgets, they're thinking of budgets. So it would be kind of fun to time one in the middle of our budget process, or maybe before the budget process, to kind of get a feel of what we're going to do to the citizens of the, it wouldn't change anything, but it sure certainly helps, I think. I don't know, maybe it doesn't. I don't know.
But they want to continue too, which was good.
Well, I don't, just, it's nice that we're all on the same page, I think.
Yeah.
Or understand.
Lakes and Pines had a meeting Monday. I've had many meetings on Monday, all just about the same time, so it was quit one early and got to one late, but anyway, amongst all the contracts that got approved at Lakes and Pines was something for Sandstone and Hinckley in those community development grants, and Lakes and Pines will help administer those. So they get some money for doing that. The real winners are the cities, the citizens that live in the cities where that's taking place. So that's good to know. And then the Blandon broadband community.
It was so hard. I was on the initiative committee, the initiative thing, and we just kept coming back. It's hard because you don't have broadband,
right?
You know, and so how do you help people to be able to utilize all of these things that are at their fingertips when they don't have the broadband to be able to utilize it? So yeah, that's where our group went.
Yeah, I don't know. We'll see where the next one.
Yeah.
If we.
This was just trying to figure out where.
How's that moving, or the trajectory of all that?
I think it's actually moving, Matt. I think I'm anxious when we can have a committee of the whole meeting and get the hometown fiber people and Leslie there to explain the work that they are finding in Pine County. I think that'll shed some light on where we need to go, but.
Yeah, so is it something that, do we have to keep nudging it? Or,
think-
to keep it moving, or is there something we need to do as a county?
I think Leslie used a word last week called simmer. Keep
Perfect.
Leslie, I've used that word about 1,100 times now since you used it, because I think it's so appropriate for what we can do as board members to keep the pot simmering on broadband. There might not be something that we have to do right now or we can do right now, but I think the fact that we keep talking about it, it keeps it in the forefront.
Is there people we should be talking to?
I think Leslie, I think this hometown fiber group that we have hired to be our consulting group is going to be our helping agent to help us define what our next move might be.
And how about back to your East Central Energy? Do we have a list of people there we can talk to? I don't know any of those people. So.
That East Central Energy has a meeting on Friday with their board, which will give them permission to continue to go down the path of doing a feasibility study and such. And then they think by about March, they're going to have to decide if they want to push all their chips to the center of the table and dive into this thing.
We're trying to bombard them with letters of
Yes.
support. So if you haven't written a letter yet, write them a letter.
And Mr. Chair,
I said, we're trying to bombard them with letters to support.
Oh, I haven't seen anything.
Oh, no, so send them a letter. Their meeting's Friday. So just send it to the board of directors, and
I knew that was brought up at the.
we did it
Cool,
here.
yeah.
Yeah, and we did it here as a group too, as the commissioners.
Okay.
and Mr. Chair, just to answer Matt's direct question, if there's anyone at ECE to talk to, on their website is a list of their board of directors.
Yeah.
So if you go to the website, or if you have trouble finding it, let me know. But if you know any of those people who are on their board of directors, that would certainly be a good reach out to do.
Is it something that the county board could send a letter?
We did.
Yeah,
Yeah, we did.
But so we've got ECE, I mean, you had asked, do we have to keep pushing? ECE stepped up, and then finding out that we can utilize that fiber that's in the ditches. Or, probably a lot of it, but not all of it. That's going to be huge, and we'll find out more about that from Hometown Fiber. But there's all these things that are happening that it's exciting, right?
Yeah, I think, Leslie just reported on the thing on Section 8 that we did, she's walking through the steps for the grant for them to start doing the environmental, we've got to do the environmental impact statement and stuff for the work they're going to do. Contractors that work for Midco have been very busy this fall plowing in fiber to some developments in Rock Creek and on the northeast corner of Cross Lake. So between those two projects, I believe they're going to pass in front of around 1,000 homes, 900 and some homes. So that's a big dent.
A big deal.
Big dent.
And I think the grease that loosened everything up is there's an unprecedented amount of federal money that is coming down the pipe, that everybody who thinks they can build or operate a broadband network is now interested. And I think, to the county's credit, having broadband on our radar as a priority for the last couple of years, and then really giving it a shove last January, and a commitment to it, has set us up well. And so if the board does nothing, there will be some broadband activity in Pine County. The fact that the board has been very active is going to just multiply that activity. And so in addition to the small cities grant that Leslie was talking about, we still have that grant in for the community project to the federal government that we don't expect to hear anything, I don't think, until January on that. And then Hometown Fiber will come back with some ideas for our local grant program, and that program will encourage, align with the federal money that's coming.
So any other meetings we got to report on?
I have a couple others.
Yeah.
We had the meeting with the Marx Band.
Oh, yes.
And the one thing that was exciting about that was them becoming an initiative tribe. They're looking at 2024 of seeing that happen.
Oh, I forgot to mention it in our health and human service report. You know, Becky was doing that work with them there. Oh, yeah.
Yep, she is. Yeah. So they had said that they weren't able to get any information from the state. So Becky's kind of helping them to get the numbers that they need so that they can get it going. But I had it in my head 2023, but it's 2024 that they're actually looking at, that they're looking at going live with that. So that was really good.
How is that meeting going? Is it still going good with the tribe and you're keeping stuff?
I think we gained some new traction now. You know, it took us a while to, you know, anytime you have new people sitting at the table, it takes a little while. So get to know them.
The band does now have an initiative coordinator, Jamie, who is assigned this task. And so I think that will make it easier for them to make progress and easier for the county to have a single point of contact on these issues. And then we also talked with Jamie Edwards on the call about a couple of legislative issues that I got a more positive response from him than is typical with the SSIS paperwork reduction and then the ICWA and out-of-home placement funding generally. And so those are two issues that we'll follow up this afternoon with our legislators, but then hopefully we can follow back up with Marx Band and trying to get a coordinated approach.
There was a problem, remember a year or so ago with how long that, like, we're used to handle our health and human services have a 24-hour response time or whatever it is, and theirs was different. Did that ever get lined up?
Yeah, I think that was some personalities.
Oh, because yeah, you think the rules would be the same.
Well, yeah, they are.
Yeah.
But they were interpreting differently.
I have one more. The egg educator, I just wanted to give you all an update on that. The deadline for applications, if you know of anybody that wants to apply for it, is December 1st. But at this time, we have 3 applications in and 1 person interested, and I'm planning on filling one out. So I thought that was good news.
Thank you. Any other business? If not, we'll one other thing, on the community, on the school meeting, we do have another meeting scheduled, and that is for March 23rd. Oh, that's a long time ahead, but.
You know, I was going to tell you too, did you notice that the tribal meeting is changed from January to February now?
Yes.
Okay.
Yep.
Yeah, and that will be at the casino. And when we met with the band, they said, well, I don't know how they put that in because we can't do it. And I noticed it got changed, so they realized that, so.
Okay, we will recess until 1. Is that when it is?
Yes, 1 p.m.
1 o'clock, and then we'll meet with our legislators.
The afternoon session will not be live streamed.
Yes, thank you, David, for reminding me that. If you're on live stream right now and you want to be part of the
leave our stuff in.
A discussion with legislators, you got to drive quick to the North Pine Government Center. Come over there. We are in recess.
Oh, he said.